Hi, I'm Mel Pickup, Chief Executive of Bradford Teaching Hospitals, and welcome to this month's roundup of stories from across the Trust. We began September by highlighting one of our long-standing partnerships as we heard from Russ Piper, Chief Executive of Bradford-based Sovereign Healthcare. Russ told us how Sovereign supports the NHS through its community programmes, and we heard from Sharon Milner, Charity Director for Bradford Hospitals Charity, about the generous contributions it has made to the Trust.
We were formed primarily to raise funds for the hospitals in Bradford. We provide a type of general insurance which helps people access everyday healthcare, and we help towards the cost of that. We look to do the best we can for our customers when accessing everyday healthcare. Bradford Teaching Hospitals has been a special partner for us, and we've made some significant donations, and we've been delighted to do so.
I'd like to say thank you, what the difference they've made to all the teams here, not just one single team in one single department, but across the hospital. We cannot do the things that we do without organisations like you. They've done it in such an amazing way, and the impact on everybody has been phenomenal.
We wish Sovereign a very happy 150th birthday as it celebrates next month. Our second film gave us an insight into the work of our legacy nurses. This is a team of experienced registered nurses who are employed specifically to provide support and coaching to our new nurses and nursing associates. We heard from John Kelly from our education department, who told us about the team, why it was formed, and the benefit it brings at both an organisational and professional and personal level. We also heard from legacy nurse mentor Amelia Burton about the support the team offers.
We've got 5 legacy mentors from a variety of backgrounds, some children's nurses, some adult nurses. It's a fabulous role for those people that are coming towards the end of their career. They're also helping people in their transition into the organisation so they can stay happy and stay healthy at the Trust.
I started working here as a paediatric nurse, just to have somebody that would come and visit me when I was on shift to say, "You're doing a good job." It would have definitely been beneficial to me. You see the positive change almost instantly. I spoke to somebody yesterday and she said, just to have been able to speak to you for 30 minutes has improved massively, and it's really nice.
The best possible outcome, if it all goes well, is that we have massive inroad into the retention. If we can do that, we get better patient outcomes, and that's why we're all here.
Thank you to John, Amelia and the whole of the legacy nurse team for their important work. I was pleased that we were able to highlight the story of brothers Shakur and Maroof Ahmed. Shakur shared how he made a living donor kidney donation to his brother, and we also heard from Razdi Igasan, our specialist nurse for organ donation here at the Trust, who told us about the need for more donors after death, particularly from the Black and minority ethnic community.
I went into hospital. It was actually a very quick process. Before I knew it, I'm back out. But the first thing that came to my mind was straight, has it worked?
The quality of my life increased, and it was a new life. I could eat and drink whatever I wanted. I was a totally different person. He's not only given me life, he's given my wife a life, he's also given my kids a life.
Having him at home has been a massive blessing. Since I've had my operation, I completely forget that I've got one kidney unless somebody mentions it.
Within the Bradford community, a third of the waiting transplant list is from the Black, Asian and minority ethnic groups. Patients have better transplant outcomes if their donors come from the same ethnic background. Around 60% of the families from these communities would decline organ donation. So what we are encouraging everyone to do is to sign on the organ donor register.
Thank you to Raz and the team. On the podcast this month, I was delighted to welcome 2 colleagues who are also ex-service personnel as we discussed our recent veteran-aware accreditation. Fiona Mattison joined the RAF on the youth training scheme aged just 16 and is the complaints lead for urgent, elderly and specialist medicine. She was part of the team that worked on the accreditation. And before joining us here at Bradford as a service manager for surgery and digestive diseases, Bashir Ahmed served around the globe during over 23 years in the Royal Army Medical Corps.
I have my veterans badge on my lanyard, and I was going to different areas to pick patients up to take them to different areas, and I had a lot of patients that would say, "Oh, did you serve?" Yeah, and all the way around we'd be chatting. I had one gentleman saying, "What was your best bit in a ration pack?" And I said, "Oh, my best bit in the ration pack was the bit that everybody else had hated, which were brown biscuits." Do you remember those?
I do. You used to call them dog biscuits.
Yeah, and I loved them for some bizarre reason.
So going back to Bash's stories of swapping what was in, you must got loads of brown biscuits then, Fiona.
Yeah, and you would always trade. You would always know in your ration pack what you liked. So it was about getting the first people that you could manage to get to swap.
You can hear the full episode of my chat with Fiona and Bashir by subscribing to the podcast. It's available in all the major podcast providers. Simply search Let's Talk with Mel Pickup. Well, that's it for this month's update. I look forward to sharing more stories from the Trust with you next month. Don't forget, all our latest news and updates can be found on our social media channels, Twitter, LinkedIn and Facebook.